The country is firmly in level 1 of the national lockdown. But with the easing of restrictions, what are correctional services facilities responding to COVID-19, especially with prisons that are overcrowded? Today, we get a look inside the Masikane prison in Pretoria, and joining us now is our reporter, Silindelo Masikane. A very good morning to you, Sli. So, we are looking at places of events where people are gathered. We're looking at churches, that are now going back in full swing. But there is also a focus on, the Masikane, or essentially correctional services. What is happening there?
Well, I don't think it's every day where we get an opportunity to have a look really inside the correctional services facilities to see exactly how they're responding to the COVID-19 pandemic. However, officials here have allowed us in, but we're also here to observe an event that's taking place. As you've stated, at level 1, we are seeing gatherings taking place, and we have an event here that's here to, it's a feel-good event where women prisoners have been gathered, and they're going to get some donations from a particular organization called Bikers of Africa. I'm actually joined by one of the representatives, Ms. Sally. Thank you so much for your time. Just tell me why it was important for you and your organization to come to Masikane today and to hand over these donations.
Thank you for having us. We started Ladies Behind Bars last year when we saw that as a result of GBV, most ladies find themselves incarcerated or against the law in a way, either being in self-defense or any other circumstance or poverty, economic abuse, financial abuse, where some of them have to go and shoplift in order to feed their children. So we started this concept of Ladies Behind Bars within Bikers of Africa, because as ladies, when we ride, the bar that we hold, we are behind it. And we then said it's appropriate for us to associate with these ladies because we come from different backgrounds, we come from different walks of life, and we are a very much rainbow nation as us. So we felt that there's a need for us to come and support, also to alleviate the state from providing certain necessities. So we are here to affirm these ladies, to show them that there's forgiveness out there, there's restoration, so that when they leave here, they can become like some of us. Some of us who are riding here, some of them are CEOs, are executives in their organizations, some are community leaders, some are politicians. So we are saying to them, you are no different being inside. When you come outside, there's life. When you come outside, come and join organizations that will take life forward. So we are very, very in touch with this center.
Okay, thank you so much, Ms. Sally. I just want to bring in the area manager here for Masikane, Mr. Emmanuel Koza. Thank you so much for your time, sir. Just to give us a sense of how the prison has been responding to the COVID-19 pandemic from when it started to where we are now. What challenges have you faced?
Thank you, ma'am. In our case, initially we got very worried, thinking because there was this outcry saying that, because people are incarcerated, they are going to die in numbers. But I can confirm that that has not happened. And in our case, we had worked very hard to make sure that we put measures in place. We make sure that we have isolation cells to make sure that when the offenders they arrive on admission, we make sure that they are quarantined, and those that are positive, we make sure that they are isolated for the required period of time. So I can safely indicate to you that from March 2020, we were able to make sure that the offenders and our officials are taken care of. We had the necessary sanitizers and make sure that we put the necessary protocols in place. And I can safely indicate that I'm talking on Masikane issues at this point in time. I can able to indicate to you that from that time, we had up until to date, we had positive cases of offenders of about 430. And currently, as of today, we have got only one case that is positive, and we had experienced fatalities, death of about 11 offenders. And we can also indicate that out of the total of about 6,300, 6,700, we were able to vaccinate 3,541 offenders. With regard to officials that were positive as well, you can see our numbers are running less than 500. With the officials as well, we had about a cumulative total of about 495, and active cases at this point in time is 0. We don't have people that are positive. And in terms of death, we also have 11 deaths. I don't know how it happened, the same numbers between officials and offenders. And out of 2,300 officials, we were able to vaccinate 946. The challenge with the vaccination of officials is that we don't have control over their vaccinations, and some of them they report, some of them they don't report. But this is the totals that has been reported, and I'm definitely sure that the total can be more than that. We are busy trying to be able to get the totals, as well as on the offenders that has not vaccinated. At this point in time, we are also making sure that we still continue to go to their units and encourage them to vaccinate. And I can able to indicate that at this point in time, we are able to manage the spread of COVID-19, and we can also manage to deal with those that are positive. As much as you know that on admission at the remand detainee, we receive people that are coming from communities. We also, like the one that is positive now, was admitted during the week. After we tested that person, we realized that the person was very positive. And then in most cases, we are making sure that we comply to the protocol. The social distancing in the center is a challenge, but we are trying very hard. But we're making sure that in our cases, we manufacture masks for the offenders, and we as employer we also provide masks for our officials, and we also make sure that we have awareness sessions daily onto various units, various categories of our officials that are coming on duty. So we are very equipped in terms of that. We don't have a challenge with regard to the sanitizers, masks, and all those PPEs that are supposed to be there. As much as you saw also the people from the Bikers for Africa, they are also coming on board. They are also contributing the issues like masks and sanitizers. They're also coming on board to give the support in terms of sanitary pads, toiletries to be able to give the offenders. At this point in time, I have about 185 female offenders, and I brought in only 40 of them in here to be able to have this event going on. So in most cases, we can able to confirm that we had done our level best. And if you can compare those numbers, you can see that as Koshimamburu, we tried very hard to deal with the issues of COVID-19.
Lastly, when it comes to visiting visitors, we're at level 1. Is that allowed now to have visitors at the prison?
Yes, visitors are allowed. But we only allow visitors, those that has phoned in to book for the visit in order to minimize the high volume of visitors. So we are encouraging community members to phone during the week if they want to visit over the weekend. Then we make appointments for them to be able to visit.
Thank you so much, Mr. Khoza. I think that's what we can do. Thank you so much. Morena, as you've heard from the area manager here at Koshimamburu, that the prison has really done quite a lot of work to try and minimize the spread. And while they do have some infections, they have been able to control it. And they are saying that they're actually doing their level best to be able to ensure that there's social distancing, even though in this kind of a facility it is quite difficult.
All right, Mkabela, thank you so much. That is, of course, Silindelo Masikane, who is coming to us from the Koshimamburu prison, where she was speaking to Salemutsweni of the Bikers of Africa and Emmanuel Khoza, who, of course, is the area commissioner there at the prison.